So some people have come up to me and said, I don't know about music therapy. Others of you may be experts. You may have received music therapy. You may already be trained. You'll be coming from many different standpoints, and including your attitude to music. So Niall said that I'm a musician, and in the UK, music therapy happens. We are interested in listening, but we've particularly focused on working through live interactive music making with people for their benefit. And so to start, I would like you to just turn to your neighbour, just in pairs, and first of all, just talk to them about music. What does music mean to you? Perhaps 2 minutes each. So this is very quick. Okay, do that first. Okay, thank you very much. I'm sure that's rather frustrating because it's probably interesting, and you could probably now give the lecture because just a few ideas, maybe anyone who feels willing to share something. Yes?
You can't fix on any one genre.
Okay, you can't fix on any one genre of music. Yep.
Music can connect to your emotions, so it's very emotive.
Yes. Thank you. Anything else? Yes.
I think it connects everything, every aspect, both emotional, logical, and physical with thought. So
Yes.
it connects all of us.
Yes.
I go to like 50 live gigs a year.
This lady goes to 50 live gigs a year. Wow.
I found it like when I'm jumping around, screaming, singing very loudly. I find like all emotions are coming out, all the bad things.
Yes.
I come out feeling very happy, energetic, adrenaline and all.
Yes, so it works. I mean, I'm sure that there are many, many other things that you discussed, but it can work really in those comments. It can work intellectually, so you mentioned thinking. It can work at an emotional level and an active level. You mentioned movement, and it's very rare that one doesn't think about moving. So one of the basic theories of music therapy goes right back to early infant child development. I'm sure you know this, and you're also studying psychology, so you've probably already studied child development. And you may even have seen videos of a baby being born, or you've been present when a baby is born. And at the very beginning, you don't communicate with the baby by saying hello. I think we'll call this baby Johnny. Most likely, the baby might be crying at the beginning of the life. We don't know. This is very general. But later, the parents interpret the cry way before any spoken language. And that really forms the basis of the theory of music therapy. And so even when people are in their 80s and 90s and suffering maybe from something like dementia, one can tap into the early reflexive interaction of music. So the second thing, and this is the last interactive thing I'm going to ask you to do, I would just like you to turn to your neighbour, and this will be really a bit chaotic. And one would hope one could do this in quiet circumstances where there's only the two of you in the room. But if you could please try and babble. Musically babble if you feel you want to, but communicate with your neighbour without using any spoken words from your culture or your language, and just see what happens. With sound. Okay. Woo! Okay. Thank you. And we're just going to do one more thing now with you all together, just to show the active aspect of music. So, you can stand up if you want to. Wow, there we are. So, this is the basis of music therapy, really seriously. That's amazing. There are probably over 200 of you. And we had synchrony, we had exact rhythmic repetition, we had pitch, and everyone knew what to do. Everyone just intuitively knew, without me saying, could you please repeat after me this? So hold that in mind while I go through some of the more theoretical stuff. Maybe you want to know a little more about the background of where I come from. I worked as a music therapist for about 30 years in the National Health Service. And you may or may not know that music therapy in the UK is established. It's an allied health profession alongside occupational therapy, physiotherapy, speech and language therapy, and other allied health professions. However, despite that, and despite some of the research I'm going to tell you about, you might not find a music therapist in every service because the NHS has to prioritise. So one of the things I've been passionate about over the 40 years, and my latter years were working in a university, but attached to clinical work that people are doing, is to try and make the case that music is central to development, and for all the reasons we just spoke about, and that music therapy should be embedded in many different pathways, particularly where there's a deficit in communication. So I will cover, in particular, some areas of people who may benefit from music therapy or have done. At the moment, I'm at Anglia Ruskin University, and we have worked very hard to establish a research unit. So in this building, which is a converted Victorian school, we have the Cambridge Institute for Music Therapy Research, but also master's music therapy trainings and also drama therapy training. And we train students together because drama and music are very closely linked. And my job is now very much supervising research and setting up partnerships so that we can continue more research and also more clinical work across many different areas. That's just a photo of the building. Here's one definition. Music therapy is the use of music to work towards therapeutic aims. And in doing that, you set up a musical relationship. So we would assess a person and find out why they might be seeking music therapy or why someone is seeking it on their behalf if they can't let us know that. Very often it might be because there's a lack of ease in speaking or in communicating through ordinary language. and that sound and gesture and music and rhythm will be a way in for that person, but not always. Sometimes music is an adjunct to words, so we also have an approach which is music psychotherapy, and I'll come on to that. So that would be for people who can move between words and music making. So it might be they feel more locked into themselves and unable to get the help they need if they're feeling depressed through talking, but actually through making music or listening with the therapist there and moving between music and words might be the thing for them. So we would always carry out a meeting, which we call an assessment, to find out how music might help that person. Sometimes it might not. So we may say, well, I think this person should be referred for art therapy or for drama therapy or for psychotherapy. We work in teams as much as we can. And I've already spoken about in the UK, we've gone down a route where music therapists are musicians. So they've trained as professional musicians, they've got usually a music degree, or they've been to a conservatoire, they've worked as a music teacher, they can play 2 or 3 instruments and sing because the work happens through music making. But listening is important as well. And so that's probably why we've paid attention to improvisation. But just to go back to the more formal structure of music, some of you may have studied music, you might have studied music psychology. You mentioned that music could cross many genres. I came from a classical music background, but I've now moved into all sorts of different worlds, so I can sing popular music or jazz. But to begin with, going back to just a simple example of how music may help people in groups is if you deconstruct what's happening in a piece of classical music. So you're about to hear just 2 or 3 minutes of a Bruckner symphony. And I was at the Albert Hall quite recently, and I nearly fell off my seat when the brass section came in. So I was sort of listening, probably my mind was wandering a bit, and the violins were going away and the strings were playing, and suddenly the brass came in, and it really made everybody sit up. And then there was a bit of a dialogue, and what you hear in this small clip is the strings actually continue without really engaging with the brass, and then actually they get swept along with the full orchestral group in the end. So we do group work, and I'm not sure I'm going to get to clinical examples today of music therapy group work, but in a music therapy group, people would improvise together, and the communication is quite exaggerated. So when you're having a speaking conversation, usually, although not just now when I asked you to do that exercise, but usually in a group conversation, let's say in a psychotherapy group, there might be a bit of debate and argument, but usually there's 1 or 2 at the most people trying to talk at one time. But in a music therapy group, you can get the sense, the essence of the group and the interactions through making music all at once. It's complicated. And as the therapist, one might guide that musically by playing certain aspects of music, structured or not. Or you might just listen and the group find its own way forward. So here's the example. It's very quick. There we go. And they come back. Listen to me. Okay, it's it's something to hold in mind. Oh, here's another definition. The systematic application of music within a therapeutic context for therapeutic purpose, drawing upon live and receptive possibilities of music. This could include free improvisation, structured or unstructured music, or sessions could draw upon composed or pre-composed music, such as through songs or songwriting or receptive techniques involving listening to music. There's a lot of words there, but we need this. We need this to be written down in order for other people, medical colleagues, psychology colleagues, others, to actually get to understand what a music therapist might be doing. So I'm going to try and give you examples of all those different approaches in this introduction. I've also touched on the social, and I think maybe you spoke about that in your pairs. No one particularly focused on that, although you said you go to gigs and you danced about. But there's a social element. Someone came up to me before we began and talked about singing. And I know that there are lots of singing for health and singing for the brain groups. And music therapists also are engaged in that work, but they might have more of an approach for people who perhaps can't access the more public, open sessions that are for anybody. And here is, I don't know if you've read that slide by now, music is essentially a social activity involving communication, listening and sharing. The skills may be developed within the musical relationship with the therapist and in group therapy with other members. And so what can happen is, as people develop a greater awareness of themselves in relation to others, which is sometimes the reason people come for therapy. In my years in the NHS, I was working in a mental health service for adults with different types of mental health problems. And often people had become very isolated, or other people didn't appreciate the way that they behaved or the way that they were in themselves. And so through making music together, we could think about that in a different way. So someone might say, well, I don't like your drum playing, or I love your drum playing, I want to join you more. And that's, in the drama therapy field, that would be called distancing. So in the arts therapies, we might use the art form as a way of just actually, rather than getting closer, but to step back a bit. Because for some people, actually speaking about something that's very personal and that's really upsetting might not be the place, especially in a group. But taking one step back and using, say, in this case, the musical interaction as a way of understanding something could be helpful. So there are many different layers. People's self-esteem could be helped. Someone can become a leader. So I don't know if you've studied cognitive analytic therapy, because I know this is a sort of psychology set of courses people are doing, and you've just had a talk. Maybe this is relevant, I don't know, but people fall into patterns of reciprocal roles, as we call them in cognitive analytic therapy, which is an approach to talking therapy. And there's an unpacking of whether people are more comfortable being in a leading role or in a subsidiary role, or and what's the opposite to that, and sometimes how it's important to try and sort of get inside the way of being that's most alien to you or that you find most difficult. So we might even rehearse something like that through music. We call it musical role play. That's in the more sort of psychodynamic, psychoanalytically oriented approach. Very simple diagram. Some people like diagrams, which is that obviously there are many different things going on. But in music therapy, there would be the client, patient, participant. This has come from a medical colleague, in fact, this diagram, because I'm not so good at the diagrammatic side of the work. But and I just think it's a very interesting way of conceptualizing what happens, and you'll see some examples. So some of you may be thinking, if this is introductory to you, you might be thinking, well, I'm a musician, and I go to a jam session every week with my jazz colleagues, or I just love music making, and I'm in a band, I sing in a choir. And years ago, when we were working out the sort of way that music therapy works, there was a challenge. So what is clinical improvisation, i.e. what is different? And really, I would say the answer to that is that you could hear two pieces of music. One could be an example from a music therapy session, and the other could be an example of two friends just making music one evening together. They might sound very similar. So one answer to the difference is the intention is different. So in music therapy, the music therapist would be there to help the other person. And of course you might be helping your friend, but that might not be the only focus. You may just be having fun and playing. But we also have fun and are playful in music therapy. But I suppose the intention of coming for therapy for a series of time and also having a focus of how music might help you makes it different. But also, musical improvisation is any contribution of sounds and silence spontaneously created with a framework of beginning and ending. You may or may not agree with that. Then we would say as music therapists, in music therapy, musical improvisation with a specific therapeutic meaning and purpose happens in an environment facilitating interaction and response. So again, really, mainly it's the intention that's different. But perhaps also we're training students to listen in a particular way, so to step back. I call it listening with the third ear. So someone who's seeking therapy, who's come to a session, is playing, and I think the way you engage, it depends on why they're coming, why they've been referred. So for someone, it might be helpful that they move into a free improvisation structure with no repetitious rhythm, because that might be the thing that would help them. For someone else, and I work a lot with people with dementia, actually moving into a recognisable rhythm that's predictable and that might be familiar and might help trigger something that they feel familiar with and that activates a part of the brain that can help in that way would be important. So it might be the opposite. The therapist's role might be to provide a very definite rhythm or think of a familiar song that they know that person knows. So there's a lot of thinking and planning that would go on. I mentioned the psychoanalytically informed approach, which is an approach I've used for many years and developed in the adult mental health field. And if you've studied post-Freudian and Freudian psychoanalysis, some of you may or not be familiar with terms like countertransference, but we have tried to define musical countertransference. So it's what you pick up when you're making music with someone that's not explicit, in a nutshell. And we've used a lot of theory and a lot of experience already there in the field of psychotherapy in order to inform our work, especially in those areas of the unconscious. Coming back to a more practical level, I'm going to give some examples now of work in progress or work that's happened quite recently. And thinking about why music therapy might be helpful for people when they're aging. So I'm going to start at the sort of older end of the scale. Louis Armstrong was known to say, "What we play is life." And I've already spoken about early infant interaction theory. And in fact, we've covered all this. We've covered the way that music might help in developing relationship, in developing play, and that music is important in all the aging process, whether or not people have trained as specialist musicians. So the therapist needs to be able to pick up and be trained as a musician, but the people coming don't need that because of mostly the innate qualities that we all have in relating to music. Because of the non-verbal communication aspect, these are some of the priority areas across the world, indeed, not just in the UK, And this is a bit, I don't really like labels, but I will be using them because it just explains something about groupings. And we are in a culture where there is diagnosis, and if you have a certain diagnosis, then you get a certain input sometimes. So Niall mentioned the House of Lords Commission. In fact, what's now being rolled out following that is a music and dementia strategy for the UK for people with dementia. And that's because of the fact that music is so important in this process. So that's why, maybe that's why dementia is at the top there. For people with autism, music therapy really helps with understanding the other and getting inside the other person's world in a different way, because that's often the thing that is most difficult. And again, I'm generalising. But one of the things that people who have a diagnosis of autism or on the autistic spectrum find is that they don't always naturally read signals from the way someone speaks or the way they look or the way that they're interacting socially. Music can sometimes help with that in an exaggerated way. Learning disabilities, so people who have been born with a learning disability, with something that's affected their cognitive development, may be able to access music therapy. There's a lot of work that music therapists are doing with children and adults and with their families through music making and music therapy, where access to spoken language is sometimes non-existent or very delayed or difficult. When I was invited, I suppose because I'm a researcher and a clinician, I said, oh, I'll talk about research. And Niall said, no, can you please speak about an introduction to music therapy? But I think the two are linked. So if you'll forgive me, I will just talk about research. This is interesting. So we were part of a multi-country and multi-centre trial, which was funded by the NIHR, which is the health service research funder that funds lots of drug trials and medical research, but also psychological research in the UK. And there were 350 participants across the world who were having music therapy once a week, music therapy 3 times a week, or no music therapy. So it was a randomised controlled trial. And we didn't find very significant outcomes, even though it went on for 3 or 4 years and it was very, very intensive. And one of the reasons is because it's very difficult to find those changes through some of the outcome measures that we're using. So we're really trying to refine that. But what we did find is that all the parents whose children had music therapy, so that's a third of 350, so that's a lot, commented that they felt they could see changes in their children's social behaviour. And so one of my colleagues is studying that for a PhD and writing up the outcomes of that. So the music therapist offered parent advisory sessions, in fact, which were very highly attended in the trial. So I'm also making a point about not just research, but also families. Here's some examples of what parents said. So we were gathering data across the world, in fact. But my child looks so happy every time he comes to music therapy. He's been talking more, allowing more eye contact and smiling more. His little face lights up every time he hears the word music. My son never played with his brother. Since attending music therapy, he's been initiating playing with his brother. So the play element is really important in this work. I'm sad that the sessions came to an end. My son has benefited a lot, and he has built a warm relationship with the therapist. It is not easy for him to accept people in his life. Through his relationship with the therapist, he's grown a lot. I've decided to be a parent governor in the school and advocate for music therapy. So I suppose you can tell, and in the introduction, I'm a bit involved in the politics. It's because of the passion of believing that people should have access to this. But that's a really important outcome, I think, as well. But it's not related entirely to the child and the outcome. Here are some other projects. I won't be able to speak about them all, but I'm trying to give you a flavour. And so these are things happening in our centre. Music therapy for children with local schools. We've got some small grants ongoing, and people come to our centre where we have teaching and lecture rooms, but also therapy rooms for a clinic. So that makes it a very rich atmosphere. People are coming to the university for therapy rather than going to a medical environment, which can be important, but this is something we're offering in the community. And they can have music therapy with trained music therapists, or sometimes with our trainees. So and that's a very good experience for them. We also have a colleague, we've got many people studying PhDs, and there are other places doing that too. There are 7 music therapy training courses in the UK, soon to be 8. Spread across, there's one in Scotland, one in Wales, one in Limerick, in fact, not Northern Ireland yet, and one in Bristol at the University of Western England, ours in Cambridge, 3 in London. Across this, we have people, as I said, undertaking PhDs, and Dr. Alex Street, who's worked in many different areas in the UK, is undertaking research looking at upper limb movement. So this is a very physiological approach to music therapy. And there's a specialist approach called neurologic music therapy, where you would go on to do a specific training, which is quite rhythmically structured and which links to the way people move, particularly physically, but also that looks at the neuroscience of what's happening. So, for example, it's really important to work with someone as early as possible when they're recovering from a stroke. So in Cambridge, Alex has now got his PhD, and he's been seconded. Adam Brooks Hospital are paying for his time 2 days a week to work on the stroke wards there and do further research, because we really can see that there are patterns emerging that can help people, because there's a sort of neuroplasticity moment after stroke when music itself can actually help shape the neurons, the part of the brain that might be helped in terms of movement. And there is an emotional outcome as well, usually for people, but this is a particular physiological way of music therapy working. And if you're interested in research, I will try not to go on about it too much, but there are Cochrane reviews. The Cochrane Library does meta-analyses of research studies, and there is a positive Cochrane review on music therapy and gait that's been gathered together, all the evidence from different studies across the world, and it shows that music therapy is beneficial to help people recovering from stroke with their gait. And you can imagine, so literally the music therapist is one end of a corridor perhaps with an instrument, and they're making music while the person walks, and the music motivates the person to move. And that is what my colleague's also working on with the upper limb movement. So that helps coordination for someone who has paralysis on one side, for example. So, yes, so I'm coming on to the couples work with people with dementia. Okay. We've got 5 more minutes before we have a break. So there aren't many music therapists qualified after all these years. There are many who've trained. We train about 100 people a year in this country. And most who really want to would get some form of work, but it's usually a portfolio type of work across different organisations. Although I've mainly had a full-time job in music therapy through, and there are people now who do, and there are full-time jobs. But yeah, we need to keep an eye on that. And I think I've covered everything else on that slide. Here's some more research that we've been involved in. And I just mention this because there is also some very important research coming out that shows that music therapy can reduce agitation, but that it can also help carers. So I'm going to talk to you about a project for couples where one person has dementia and the other is their carer. And they come to a group every week for a period of 10 weeks. I've got some examples of that. It's called Together in Sound, and it's a collaboration between our university and a concert hall, which is in a comprehensive school. It's very unusual. But there are projects springing up where music therapists would work in a private, confidential space, but a lot of people want to develop the dementia awareness strategy. So we found in a rural place in Essex, Saffron Walden, that people want to have a private space for music therapy as couples. So there are 8 couples having music therapy together. But they also want to have a more public way of showing how it helps. And so there's a sharing event, which is voluntary. People don't have to come if they don't want to, but people have all chosen to over the last year and a half, at which we link with the professional musicians who are coming to the concert hall to give concerts, who come in as special guests. And we've been involved with people who are really well-known musicians. Matthew Barley, who's a cellist, you may have heard of, and others who've spent maybe a couple of hours with the music therapist being prepared for coming in, and then have come in as a guest, which is also a sort of community orientation of the more private therapy that's happening as well. So coming back to the theory, I've talked about the literature and the importance of supporting what you can experience and see happening with what people are finding when they're looking more systematically. And in fact, in a meta study looking at many treatments for people with dementia, music therapy was one of the things that was seen to be effective in helping with reduction of agitation and anxiety. I'm going to move on to a study that we've done in Cambridge that also found similar aspects. And this is another meta-analysis, a systematic review of the non-drug related treatments. In fact, there aren't meant to be really drug-related treatments for dementia unless it's a very, very specialist drug that helps with dementia. But what was found up until a few years ago was that tranquilizing and sort of ways of trying to manage people's behaviour were used in care homes, not necessarily in the best way at all, and not to the advantage of the people living there. And so there's a real emphasis now on the environment, how the environment can be changed, which can include all the art forms, I think, but particularly music. So not just in the music therapy sessions where someone might have a particular focus or a private session with the therapist, but actually having music, appropriate music, sort of around in the atmosphere that helps not just the people with dementia, but also the people caring. So this is really important, I think, that we're finding out these things. So just to recap, it's so obvious that I'm probably what do we say in this country? Teaching my grandmother to suck eggs. That's sort of like telling you things that you already know and you've known all your life. But still, the significance is the non-verbal possibilities of music, that it can use all the senses. It touch as well and smell. You know, those things are very accessible through music making for people. That you can have something spontaneous, that's creative, that can lead to a sense of achievement, that can be physical, intellectual or emotional, and that doesn't always require conscious thought. So it's not just in the sessions that the music therapist's role is important. The the task is also to translate that into helping maybe the multidisciplinary team or the family or carers see how that could translate into everyday life. And so this is just an example of the more sort of note-taking written work that a music therapist might do in writing up how the person uses music therapy, not just that they play something, but that familiar structures might motivate her to do something else. And therefore, that prompting and encouraging her might help to reconnect her with her remaining abilities. It's obvious, but those things are often written down, and other people obviously would be aware of them, care staff and family, they would know that themselves, but sometimes they might not have time to think like that or, to notice. And so this is quite important. And the transfer of it means that sometimes music therapists who are trained to work in the moment at the pace of a person, or to go with speeding up the flow or slowing it down, might be able to help translate that for care staff and say, well, actually, if you go at a slower pace, maybe then it'll be easier to help the person get dressed or eat or whatever it is that needs to happen. Or it might reduce levels of anxiety. And then also, this is about reading, which could be, we can see what happens in the song, so you could use that either through singing or reading. And that might make her feel calmer and less anxious. And just in case you're interested in the research, this is where we compared homes which were having music therapy input and homes which weren't. We called that standard care. And unfortunately, what we called negative behaviours, which were things like, I don't really like that term, but it's used, but were things like agitation and confusion and wandering, and maybe sometimes behaving in ways that were not helpful to other people, increased in the homes where they didn't have music therapy, and reduced during a music therapy, because it was a 5-month period of music therapy individually, but also carried on reducing at the end after the music therapy had finished for those people. So there's lots of things to think about there. And just a final chart from the same research project, which also is, it's not great for the homes that weren't having music therapy, because the sort of well-being levels seem to go down, and they seem to go up, which is great, sort of while music therapy was happening. And it's a small study, but it's certainly leading on to providing evidence that it works. This is, I work a lot with other people from different fields, and a very sort of leading neuroscientist who's a biomedical researcher was very challenging, saying, why are you doing brain measures and EEG measures and, randomized controlled trials? Because you can see, you just show a video and you can see that music therapy is working. But many funders, and particularly our National Health Service, are driven by evidence. And the pattern's changing, but still numerical outcome, more sort of scientific measures are called for. So that's why we're doing these charts. And in these care homes, we also were doing the qualitative part to the research. And so we interviewed the staff in both the homes that had been having music therapy and hadn't been. And these are just some examples of what care staff said. And they said, this person said, well, I would be singing. And then they gave an example. So this is an example of how the care staff had turned the singing into help with helping someone do their daily routine of getting washed. We're going to get you washed? I don't know what the tune was that the person used. And then I'd start into a song using their name, like, come on, G, we're going to go, let's get ready and we'll get washed. Well, so we are actually now trying to roll programs out to encourage people, if they feel able and they feel it would help, to just feel more confident in singing and using music in their daily care. And then G would look and she'd give a little smile. So it's like a communication you never knew you had. So this is about accessing all of our musicality, I suppose. This is a comment from a manager in MHA care homes. We've seen some astonishing changes in our care homes. When people with dementia receive music therapy, they become so much more responsive and joyful. It seems to have a wonderful calming effect. I've got colleagues who are music and brain specialists, and they are interested in people having EEG measures while they're making music, both people who are healthy and people who may have acquired brain injury or dementia, and looking at outcomes. I won't say much more about that, but it is really important because, as you probably know, this is just a slide which perhaps emphasises why I'm spending a lot of time talking about people with dementia, because it's definitely growing, and with medical science, people are living longer. And so worldwide, around 50 million people have dementia. That's a lot. Okay. This is another definition, and I'm just going to show you a couple more examples where music therapy can be thought about as individualised personal care through music, adapted in the moment for the person's needs and their family carers. And to recap, what the literature says is that music therapy specifically aids procedural memory. So that's like I'm about to talk to you about a man who used to be a pianist, who couldn't read the music on the stand if there was sheet music, but he could sit at the piano and improvise. So he had the procedural memory, like cleaning your teeth every morning, of something that was really important for him. We've seen how emotional regulation can work, and this isn't specific for people with dementia, this is across the board, that music can be used. I mean, it happens in shops, where in shops music is played in order to help hope that you might buy more things. It doesn't work for me because it's usually too loud and distracting, and I might have to leave, especially if you want to have a conversation with someone. So music's powerful, but it is powerful and it can change atmosphere and mood, as we know. And this is just a recap, really, of all the things that are particularly important. This is a bit more about the areas of the brain, and there's a much more integrated model now. Used to be the sort of left and right brain being very separate, but then they're now finding that there are different dimensions that deal with different things, but they're not necessarily just left and right. So, for example, the auditory cortex within the temporal lobes is engaged in general auditory perception, such as pitch, intensity, and duration. The basal ganglia, the motor system for processing rhythm. And we know that the amygdala is very important for emotions. So that's why sometimes if a person has frontal lobe dementia, they still may respond in terms of their emotional responses because the amygdala is not damaged. And that's where music will then come in. So, this is just an example of that. So this is the man I mentioned who, that's the name of the particular dementia in case anyone is interested in the different types. And this is the man I spoke about who couldn't read the dots on music but could improvise. And I'm going to play you two examples. I worked with him for 3 years. This is work that I undertook. And established a rapport at the beginning through sitting at the piano together and improvising. And so the first example is from year 1, where we just made music together, and he was often calmer after the sessions. He was referred by the psychiatrist and the psychologist, so this is teamwork. And this is quite a progressive teamwork in the 1990s in Cambridge, where we had a community. Were one of the places in the NHS that developed community work for older people. So I saw this man in his home every week because he had a piano there and there was a music room I could work privately with him. So this shows you the amount of musicality that's intact. It's really quite astonishing, but when you think about this, you think, yes, so for everybody with dementia, there are aspects of their life and their pre-programmed self, if you like, that are still there, and it ranges from in different ways. People talk about someone who can sing a whole song, but they can't hold a conversation. Well, this gentleman, so this is slightly specialised work. He's a pianist and he worked as a music lecturer in his life. So what you hear is he starts to play and then I join him. So I'm at the top of the piano and he's at the bass. And then you hear him change rhythm. So he's got a sense, an implicit understanding of syncopation. I think you'll hear that. That's him. So he starts. He's just experimenting and I join at the top. So it's a duet. I'm just following him. Listen to his rhythm. He's getting in the groove. That has meaning musically for him. And I'm just following at the top. And listen to his rhythm. He's just found this syncopated rhythm. Da-dum, da-dum, dum. So his musical language is still intact. And then by year 3, so this is the 3rd year, his musical faculties were deteriorating. He often didn't play the piano, he would just want to listen. His coordination wasn't so astute, so flexible. But a sense of rhythm and pitch was still acute. And it's hard to imagine, but at this point he needed full help from his wife, who was still caring for him at home, for all his daily living skills. He didn't really have access to ordinary spoken language anymore. And what you hear in this last example for him is, on this day I thought he wouldn't want to play the piano, so I sang. So I'm singing a song by Michael Head, the beginning of it, and then this is how we might use composed music to move into an improvisation. And you hear that he finds the same note I'm singing and he starts to laugh, chuckle. And we don't know, but it seems as if that has some meaning for him, implicitly. And then what happens is he starts to accompany me as if he's in an operetta. So it's like that bit where people sing, oh, I'm about to go to the woods and see my lover. I mean, that's not what we're singing about. It's probably not the best example, but that's what happens in opera. And he seems to implicitly, this is the procedural memory, it's as if he's accompanying me, I'm singing a recitative and he's accompanying, I'm just singing la 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 or ah, in fact, because he moves into that genre of recitative where the pianist sort of plays a chord and then the singer goes da 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 and then they go another chord, and that's what happens. We couldn't discuss it, but this is really a pure form of music therapy, I suppose, working in the moment. It's a bit soft. So this is the beginning of the humming of the song. That's him. This is Bowman. He gives me the note there. That's what they do, pianists. They go. This is. He stays. We're in the same tonality. You can probably hear that. So there's lots of research about preserved skill for people with dementia, and that's an example. Okay, in the last 10 minutes, I'm just going to give 3 examples very quickly of some different areas of the work. And I just put this slide up because one of the things that we're trained in as music therapists is not just, happiness is very important. It's something everybody strives for. But the other thing about music is that it can mirror emotion and it can help support emotion. And sometimes it's about actually finding music that supports something that's very painful for someone. Just to broaden out, music therapists also work in hospice care. They work on life stories, including music for people. They also work in prisons. Someone came to talk to me in the break about being interested in work in prisons. And this is just some research material from a colleague who studied the use of song in helping women prisoners change their self-concept. So she worked with individual people inside a women's prison over some years and looked into detail at finding ways of working. But this is the background of some of the music therapy work that you do find. That's a book about the work in prisons and also in special hospitals that's carried out by many colleagues. So that's an introduction to music therapy.